let's talk about type 1 diabetes. Okay. What is type 1 diabetes? What is it though? It's an autoimmune disorder. So what do I automatically know? There is a genetic component plus a trigger. And in this case, the autoimmune disorder affects the pancreas so dramatically it completely destroys the pancreas from the get-go. So there are no exacerbations and remissions because it's already done ruined it. Okay. Now, when we say young women this time, I mean young, like the average age is usually around 3 of diagnosis. Okay. Cool. And what happens in type 1 diabetes? We said it's an autoimmune disorder. Autoimmune means your body is attacking itself. And in this case, it's attacking the beta cells of the pancreas, which means you will never produce insulin ever again. Your pancreas has been eaten alive. Do we understand? Okay. So this is a total lack of insulin. Will it ever come back? Will they be insulin dependent for life? Yes. Okay. So the 3 chronic signs and symptoms of type 1 diabetes is 3 P's. Number 1, polyuria, which means they pee a lot. Why are they peeing a lot? Their kidneys don't normally get rid of sugar, right? That's not a normal function of the kidneys. But when it goes high, the kidneys are always going to be like, they're your ride or die, really. They'll get rid of anything excess when you really get to a bad point. Okay. They do that with calcium. They do it with sugar. They do it with uric acid. They do it with everything. Okay. So you're in a dire straits and you're like, I need help. At what blood glucose level will your kidneys start kicking in to help you spill? Over 250. After 250, they will start to spill. So if you see glucosuria, what is glucosuria? Glucose in the urine. That automatically tells me I don't even have to do a blood glucose. I will. But what does that automatically tell me? Their blood glucose is over 250. Are we clear? That was an easy question, y'all. I don't know where you went. Okay. So we've got polyuria, and then we've got polydipsia as the second P. What's polydipsia? Why are they drinking a lot? They're dehydrated because they're peeing a lot. And they're also trying to water down the sugar. Yes? And then they got the third P, which is polyphagia. What's polyphagia? Lots of hunger. And why are we eating a lot? Your cells are starving and hungry, and they think, feed me, even though your blood sugar is like 500. Okay. So they also will have rapid weight loss. Remember, type 1 comes on acutely and can kill a kid in 3 days. Okay. Perfectly healthy, normal kid, no other issues. Why would they have rapid weight loss? So when your body does not have glucose it can use because there's no insulin, it starts breaking down fat. And when it runs out of fat to break down, it will break down protein and muscle. So these kids will rapidly lose weight in a very short period of time. You with? Yes. Why would they have weakness and severe fatigue? Their body is in a massive metabolic state, right? And it is having a panic attack because all your cells are dying and you have no glucose to use for energy. Okay. So there are 2 main peak ages, usually 3 to 7 or 4 to 7. And then we see it again happen in 10 to 14. Got it? Okay. What happens if I do not treat type 1 diabetes immediately? They will go into DKA. Okay. And are y'all clear on DKA and how that works? Okay. So hot and dry. Sugar is high. All right. So usually we diagnose type 1 diabetes when they come in DKA. Okay. The typical presentation is like you've got like a 2 or 3 year old kid. Mom brought him to daycare. He was perfectly fine. Daycare calls and said, hey, he's been taking a nap for 3 hours and now we can't wake him. We're going to call an ambulance, right? So they go by ambulance into the hospital and all we know is this kid is super lethargic, difficult to arouse, low Glasgow Coma Scale. What could be the possible diagnoses at this time? I mean, there's a lot, right? I mean, the kid could be sick. He could have meningitis or an infection or a virus. He could have ingested something. This could be a drug, right? He could have come into contact with anything. He could have swallowed something. So you start doing this massive workup trying to find, you see what I'm saying? It can be difficult when they first come in. All right. So don't look at your papers. Turn those over. I'm going to see how well we know really quick. If I had a kid that was coming into the ER, okay, and I go do labs on this kid, I'm going to give you a lab or an assessment and you're going to tell me what you would expect to see. Okay. Blood sugar.
What would it be? 250 grams?
Yes. Huh? Oh yeah. They're going to be like 405. They don't have any insulin. Okay. She's like, and just kidding. Okay. So it's going to be very, I mean, they may come out with 400 to 800 at initial onset diagnosis. Okay. What would you expect their blood pH to be like?
To be low.
Why would their blood pH be low?
Because of all the acid, the ketones.
Okay, so if you don't have glucose to break down for energy, then you break down fat. The byproduct of fat breakdown is ketones. If you do not have, when you run out of fat, what do you break down next? Protein. What's a byproduct of protein breakdown? Lactic acid, which is why they go into acidosis. So it's called DKA. Diabetic, because their blood sugar is, okay, like 600. Keto, because they have ketones. Acidosis, they have lactic acid. Do we understand? Okay. What would I expect their breathing to look like? Why are they going into Kussmaul's?
Because they're trying to breathe off the bicarb, or they're trying to get bicarb. Or...
What do you breathe out mean?
I don't know.
Okay.
Hold on.
Okay.
CO2.
CO2. So you breathe out CO2, right? We breathe in oxygen, we breathe out CO2. They're in acidosis. Which one, oxygen or carbon dioxide, is my acid? Carbon dioxide is my acid. So they will start deep, rapid breathing. That is Kussmaul's. That is how they are breathing naturally. They're not trying to do that. That is your body's way of compensating for metabolic acidosis, right? Because you have two acid-base balance systems in your body. Number one, two systems, respiratory and kidney or metabolic, right? When your metabolic breaks, which it's broken, then who kicks in? The respiratory. Ma'am, are you okay? Okay. Do you want some coffee or something? Okay. Maybe somebody give her 15 grams of a simple sugar. Okay. All right. What would you expect their potassium to look like? Why would they be very high potassium? Stop it. Stop it. Stop it. Stop it. If they're peeing a lot, then they would have hypo. Okay. What was insulin's job? Open the door to the cell. Do you have any insulin at this point? Who lives in the cell? Potassium. So can it get inside the cell? No, the door's closed. So it just lives in your blood, right? Remember, insulin and potassium go on a seesaw, right? So if they have no insulin, they will have high potassium. Yes? Yes. They have hyperglycemia and hyponatremia, since those go on a seesaw as well. They would have abdominal pain. How come?
Gastroparesis.
Okay, gastroparesis could be a part of it, but lactic acid is very irritating to the gut. They're producing lots of cortisol. What's function number 11 of cortisol? Increases stomach acid. Their body's in a massive stress response. Yes? Why would their skin be hot and dry?
No. Dehydration.
They're very dehydrated and they're in a high metabolic state. Yes? All right. Why would they have nausea, vomiting? What is function number 11 of cortisol? I cannot help y'all anymore. They increase stomach acid, which is going to make them puke. Are y'all okay? It's the same concepts over and over again. Okay. How are we going to treat this? What's the number one thing I'm going to give this patient? Well, first they need fluids, y'all. Okay. Because they're going to die of shock, right? Can you die of hyperglycemia? No. Can you die of shock mod's death? Yes. So we're going to, first thing I would do for this patient is to put them on IV fluids. And then I'm going to add insulin as a piggyback. What's the only type of insulin you can give IV? Regular. Okay. You with me? And I'll go through more of the nursing care when we do DKA. But the nursing care for type 1 diabetes, okay? They are going to be on insulin for how long? Forever. Okay. Look at me, notch papers. What are 3 things you would tell your patient you need to expect to increase your insulin during these 3 situations? Number 1, when they're sick, when they're under a lot of stress. Other way.
Before you go to bed.
I gave y'all a situation where blood sugar might go very high, even though everything else is normal. Corticosteroids. If they are ill, if they are stressed, or they're on corticosteroids, those are the times where they're going to need a lot of insulin. Do you understand?
Yes.
Okay. You need to teach them the signs and symptoms of hypoglycemia because that's what's going to end up killing them. Yes? Okay. It's not the hyperglycemia that will do it. It's if they accidentally give too much insulin. Okay. So what are the first sign? What is the first sign and symptom you will teach them? Tachycardia. So when you start feeling this, that's when you need to go and do what? Eat what? 15 grams of a simple sugar plus a complex carb. Okay. And what do they need to keep with them at all times? Icing? IM glucagon and honey. Those are things that they should keep with them all the time. I keep 2 out of 3 with them. I like to. No, just kidding. Okay. So what do you want to tell them to avoid? Alcohol. Because what does alcohol do to your blood sugar? Yes. All right. It drops it, right? All right. Per day, they need to take in a minimum of 130 grams of carbs. That's not hard to do. Okay. Because carbs are literally in everything. Okay. And we need to make sure that we're monitoring kidney functions. What's the association there?
Getting rid of the sugar?
Well, I mean, they could, but yeah.
Wait.
Diabetes is the number 2 cause of chronic kidney disease. So almost all diabetic patients will end up in kidney failure at some point. So we need to monitor what labs? Creatinine and BUN. We need to monitor those at routine intervals for these patients. Do you understand? Okay. Complications of type 1 diabetes. They can end up with neuropathies. What are neuropathies?
Demyelination of the
Numbness and tingling. Okay. And it starts out just because the sugar is surrounding those nerves and they're not conducting impulses correctly, right? That's called diabetic neuropathy. What is nephropathy? That's a second complication. That's when your kidneys go down. That is called diabetic nephropathy. Y'all be real careful on the exam because those sound very close. If they said, how are you going to assess for diabetic neuropathy? And you're like, BUN and creatinine. Wait, no, my bad. Okay, so neuropathy is the nerves. Nephropathy is the kidneys. Now, why would the kidneys eventually die in diabetes? All right, so there's a lot of glucose, which means that your kidneys are having to get rid of glucose when they're not used to doing that. That's not their job, right? What's number 2 reason why it might cause kidney damage?
hypertension?
Yes. High blood glucose causes the blood to be more thick and viscous. Isn't it the kidney's job to filter out the blood at all times? Yeah. Well, it's used to filtering out water, right? Now it's having to filter out syrup. So it's high pressure, a lot more jobs for the kidneys to do, and it's having to spill glucose. Is glucose a big molecule or a little molecule? It's a big molecule, so it will bust through those glomeruli and damage your glomeruli. Remember the sliding doors? Okay. Why would type 1 diabetes eventually cause eye damage?
Hemorrhaging.
Too much pressure, which causes increased IOP. Yes. It can also put a bunch of sugar in the eye and then you can't really see. Yes. That is going to eventually cause diabetic retinopathy. Very good. Why might a patient with type 1 diabetes get a lot of skin infections? Bacteria love sugar. So if they get a break in the skin somewhere, the blood flow, first of all, can't get down there very well because it's thick and viscous. And when it does get down there, it's filled with sugar, right? That's like taking a big open wound that you have on your leg and then just pouring direct sugar or syrup right into it. That's not a good idea. I was going to say honey, but y'all know we use honey for wound care, right? Did y'all know that? Y'all don't know we use honey for wound care? I'm going to show y'all this. This is so fascinating. 1 second. Okay, side note, this is not going to be on your test, but this is just so fascinating. Okay, so y'all know honey has massive antibacterial properties. It helps with allergies and things like that. So if you have severe allergies, getting local honey is actually very, very good for you. And honey has massive antibacterial properties. Okay, so my daughter had an ostomy for the first 6 months she was alive. And she had a double barrel ostomy, you know, that's where there's 2 stomas. But hers dehisced between and it just opened up all the way down to the fascia. And of course, that would be very difficult to close because there's like poop in it, right? So this is called Meta Honey. Okay, there's only one person in all the US that makes this honey. He lives in California. And it looks like this. And so they're little pieces that you'll pull off, and we just packed her wound with the Meta Honey. Okay, and the antibacterial stuff in the honey will eat away all of the bacteria in a wound. Okay, and that's simple. Okay, that's neither here nor there. I just thought it was interesting. Okay, anyhow, another complication of type 1 diabetes would be hypoglycemia. Why would they get hypoglycemia? Because they're having to depend on insulin and they may give accidentally too much. Okay? Questions on type 1?